Hello, my dear friend. A very warm welcome to all of you in this FMGE PSM Recall Questions of 2021. And I really hope that this discussion session will be useful for you in your future exams. So, the first question is on orthotoluidine test and what does it measure? So, please remember, orthotoluidine test tell about free chlorine and combined chlorine both. So, the correct answer is 1. Now, if you add free and combined chlorine, if you add these two, this will become total chlorine. Okay. So what is the difference between orthotoluidine and orthotoluidine arsenite? See, when you do orthotoluidine test, as I have written, it first tells about free chlorine. In first 10 to 15 seconds, it tells about free chlorine. And then after 15 to 20 minutes, it tells about the total chlorine. So if you subtract free chlorine from total, you will get the combined chlorine as well. So it tells us about free chlorine and combined chlorine both, orthotoluidine test. So what is the difference between these two? The difference is that in orthotoluidine arsenite test, we can know about free and combined chlorine separately. So orthotoluidine arsenite test tells about them separately, and orthotoluidine arsenite is not affected by nitrates or other ions. So this is a better test. But remember, orthotoluidine test tells about both free and combined chlorine. You can see it is also written in the very first line of the Park textbook that it tells about both free and combined chlorine. So there is no doubt about it. Remember, first when we add the color, then what happened that in the first 10 seconds, we get only free chlorine. And then after 15 to 20 minutes, we come to know about total chlorine, the action of both free and combined chlorine. Okay. So it takes some time and does not tell about them separately, which orthotoluidine arsenite tells us about. Now, second question is very simple. What is the low stationary phase of demographic cycle is known as? And we have read it again and again. We all know it's very simple to remember. The first phase is high stationary. Fourth is low stationary. And that was the question actually, which one is low stationary? So the low stationary is definitely phase 4. Phase 1 is high stationary, phase 4 is low stationary, and phase 2 and phase 3 is early expanding and late expanding. So easy to remember if you remember it like that, because in high stationary, birth rate and death rate both are high. In low stationary, birth and death rate both are low. In between them, we have early and late expanding, and of course, in late expanding, we have our country India. And after this phase 4, we have declining phase in which we have European countries mostly. So remember all the 4 phases, and the 5th one is declining. Okay, so it is there in our notes, of course, in everybody's notes, it will be there. Next thing is that what is demographic bonus? That was a good question. So demographic bonus means it is also known as demographic dividend. Okay. What is demographic bonus or demographic dividend? See, one thing is dependency ratio, which is, I have also written here in this definition, dependency ratio. What is dependency ratio? Dependency ratio means we take a ratio of those who are dependent, okay, up to 14 year. Those who are dependent up to 14 year plus those who are more than 60 year. Okay. So old age people and young age people. And it is divided by those people who are earning money. So they are the earning population, which are the denominator. And then we multiply it by 100. So this tells us about the dependency ratio. How many people are dependent? Because this part, the numerator is telling us how many people are dependent, and denominator is telling us how many people are earning. So we want to have less and less dependency ratio. We want more people to be in the earning group and less people in the dependent group. So if we people start using contraceptive, condom, OCP and other thing, then our young age population of children less than 14 year, this will decrease. And when population of children less than 14 year will decrease, then of course the dependency ratio will increase, and then of course it will be good for the country, because I hope you understand that when there is less number of children in any population, then less dependent people are there, and more earning people are there. So if the number of children less than 14 years decreases, then the dependency ratio also decreases. And this is known as demographic bonus or demographic dividend. What is demographic dividend? It is very simple thing. When by any method fertility rate decreases, okay, so those people who are less than 14 years, they become less, and that is good for the country, because now the dependent population is less, dependency ratio is less, so now more and more people are earning. So this part is known as demographic bonus. Like currently in India the fertility rate is decreasing, and our total fertility rate is reaching close to 2.1. so currently India is getting this demographic bonus, and we are now having less dependent population. The dependency ratio is decreasing due to low fertility rate. So what is demographic bonus? This is reduction in population in last few years due to contraception. So demographic bonus or demographic dividend means we are decreasing the population by using contraceptive, and because we are decreasing the population of children less than 14 years, as a result the dependency ratio also decreases. Okay, why it decreases? Because now we have less people who are dependent and more people who are earning. Okay, so that is the concept of dependency ratio. Hope it is clear. Next question is about a male health worker who go house to house taking fever history and preparing malaria slide. So which form of surveillance is this? Of course, when you go into the house of people and search for cases, this is active surveillance. And when people come to hospital and report the cases, that is passive surveillance. So active surveillance is the correct answer, because here we are going to the houses and searching for the cases. Passive surveillance also means notified cases, cases which are coming to hospital. And what is sentinel surveillance? Sentinel surveillance tell about all cases. Sentinel means active plus passive. Okay, and in 4 diseases we do sentinel surveillance. What are the diseases? First of all, we have rated in HIV sentinel surveillance. That HIV sentinel surveillance has both the component active and passive. Remember? Second is leprosy. We search for hidden cases and we report those cases which are coming to hospital also. Third is malaria. And recently in tuberculosis also, we have TB health visitor, 1 at 1 lakh population, which is going into the slum area and searching for hidden cases. So HIV, leprosy, malaria and TB, these 4 have sentinel surveillance for all cases. Sometimes they also ask it which type of surveillance is done for hidden cases. So hidden cases is detected by active surveillance, passive is notified, and sentinel is done in 4 diseases. It includes both active and passive. Of course, we all know this thing that the male health worker, which is also known as multi-purpose worker, he makes the slide, he visit every house, and once in 14 days, he have to visit every house in the village and make malaria slides from fever cases. That is active surveillance. Okay. Next question is on the concept of open vial policy. They have 2 vaccines, MR and pentavalent. So which vial you will keep for future use, which you will discard? Remember, all the vaccines with T, all vaccines with T. For example, of course, DT, DPT, TT, pentavalent, these all are vaccines with T, plus hepatitis B vaccine, plus OPV, plus IPV, plus pneumococcal conjugate vaccine. These are all the vaccines which follow open vial policy. What do you mean by open vial policy? It simply means that after opening the vial, we can still use it till next 4 weeks if we have stored the vial in between 2 to 8 degrees Celsius and without merging them into water, like submerging them into water. So we can keep using it till next 4 weeks. So out of all the options, out of MMR and pentavalent, because pentavalent has tetanus and all, so it does follow open vial policy. We will not discard pentavalent. Pentavalent will not be discarded. So what we will discard? We will discard MR or MMR, or any vaccine other than these vaccines will be discarded. Okay. And also remember that all these vaccines with this T, these can be kept in freezer. These can be kept in freeze dried state. So when we take out from the freezer, then we do sake test and detect whether they are viable or not. Okay. But remember, we will reject all vaccines other than this. This is also from the notes. We, of course, IPV, pneumococcal conjugate, hepatitis B, OPV, and all the vaccines with T, these follow open vial policy. So we will not reject these vaccines. We will reject other vaccines and we will not keep them in our storage. We will reject them after opening them. Now, next question is, they say that there was a question directly from which vaccine follow open vial policy? Of course, pentavalent. And either of the two question was there in the exam. Pentavalent follow it. BCG, JE, MMR, they all do not follow open vial policy. Now, next question. There is a worker working in cardboard manufacturing firm and is at risk of developing. So, no one among us have read about cardboard factory. It is not taught by any teacher in any notes. But we have to apply our common knowledge and we have to think that cardboard manufacturing firm is almost similar to sugarcane meal worker, because sugarcane meal worker, when they work, they, due to release of thermoactinomycetes fungus in the air, it causes bagasosis. And cardboard material is very much similar to the material of the upper layer of the sugarcane, and it has also the chance of going into the respiratory tract and causing bagasosis like infections. Okay, bagasosis like pneumoconiosis. So the correct answer is 100% bagasosis, because we all know that bicyanosis is for cotton. Cotton means cloth factory. It does not at all resemble cardboard thing. Cotton meal worker develop bicyanosis. Farmer lung occur when farmers do not have, we all know that in village they don't have storage capacity properly. So many a time farmers have to store their grain in the houses, and when they take their grain stored in their houses to market and other places, due to storing the grain in poor conditions, they get wet. And many a time some fungus like micropolyspora, fini and other thermophilic fungus, they grow on this crop of the farmer, and when the farmer is taking this crop to the market, these fungal spores and all, they go into the air and they cause pneumoconiosis in farmer, known as farmer lung. So this is again something which is cannot be found in cardboard manufacturing firm, because farmer lung occur due to development of fungus on wet crops. And in cardboard manufacturing firms, there is more resemblance to sugarcane meal worker problem, that is bagasosis. Okay. And that is of course in our notes, but not the cotton factory, it is sugarcane meal worker. And remember the name of the fungus, thermoactinomycetes fungus. Okay. Now, recent transmission of malaria is discussed by. So, this annual parasite incidence, it tells about the incidence of malaria, how many new cases are occurring, and it also tells about impact of malaria control program, impact of National Vector-Borne Disease Control Program. Okay. So, annual parasite rate tell about incidence and impact of malaria control program. Infant parasite rate is the correct answer. It is used to tell about recent transmission of malaria. Spleen rate, it simply means how many children have enlarged spleen. Out of total population of children between 2 to 10 years, how many have enlarged spleen? That is the spleen rate. So it is a rough estimate of detecting how many new cases are occurring. Okay. So it is a rough estimate of incidence. But if you want to know the recent transmission, infant parasite rate is best. And what is slide positivity rate? Slide positivity rate simply means that out of total slides which you have tested, how many are positive? Total slides and how many are positive slides. This is slide positivity rate. So correct answer is infant parasite rate. It was done in pre-eradication era. So it is something, one question which I have not discussed in my class. It was not in my notes, and because it was in pre-eradication era and no question has been asked from it till now. But we should read about it now because it has came. So infant parasite rate, remember, it is something which simply means that how many children have parasite. Out of total children, how many have parasite, Plasmodium falciparum or vivax in their blood. Okay, and it has been written that it is an index of recent transmission of malaria, and if it is 0 for 3 years, it means that now the malaria transmission has stopped. Okay, so it is, if it is 0 for 3 years, malaria transmission stopped. Then next is proportional case rate. Proportional case rate tells about morbidity. Proportional case rate, what does it mean? It means that out of total 100 cases, how many are cases of malaria? How many cases of malaria occurred? Okay, out of total 100 cases of all the disease, out of every 100 patients which are attending the hospitals or dispensary, how many are diagnosed to be malaria? Out of total 100 people which are coming, how many are diagnosed by malaria? That is proportional case rate. Remember, proportional case rate tells about morbidity, ill health due to malaria. Next question is about incinerated waste disposed in which color bag? So we all know that red, blue, white, they all go for autoclaving first, and they all go for sterilization, and after sterilization they are disposed. But yellow category waste, they directly go for incineration or plasma pyrolysis, or they go for deep burial. If you are posted at PHC, you can bury them in by deep burial, in which there will be a cemented pit from the 3 sides and then you dump the waste. So incineration is done only for yellow category waste, and from an incinerator, all the ash that we get, that ash is deposited or disposed in secure landfill. Okay, so remember, and of course we all know that in yellow category we have the incineration as the first method of disposal. So incinerated waste should be stored in yellow category bag, and then it should go to secure landfill for disposal. The average number of children that would be born to a woman over her reproductive lifespan. So they have used the average word. Average also means total. What does here average means? Average number of children means that how many total children are produced per female. So they are asking born to a woman. So the answer is undoubtedly total fertility rate. If in place of a woman, they have used the word number of children or average number of children per 1,000 women, per 1,000, then the answer will be general fertility rate. Per 1,000 female, if they ask, it is general fertility. And if they are asking not per 1,000 but per female, it is total fertility. Now what is gross reproduction rate and net reproduction rate difference? Gross reproduction rate simply means number of female child or girl child per female. Girl child per female. And if the female goes through normal reproductive pattern, how many girl child she produced? And what is net reproduction rate? Net reproduction rate also means girl child, and it also includes girl child per female. But the only difference is that in net reproduction rate, we subtract all those girl child who died before becoming adult, before reaching to 15 years. Okay, so we also subtract the mortality or the death mortality rate of girl child, we subtract. So remember, if in the objective question they have used the word mortality rate of girl child, the answer will be net reproduction rate. If they have used the word only girl child per female, that is gross reproduction rate. Okay, so you should be clear in this 4 definition, very commonly asked. And answer is total fertility rate. Of course, we can see the difference. We can see the definition in our notes that it is number of live birth by number of female. Simple. Okay, it is total number of live birth per female. So if they ask number of live birth per female, it is definitely total fertility rate. Now, then there was a question that a pregnant lady suffered a scratch after a rabid dog bite. What should be the next step? So there is 2 group of people. One group of students are saying that rabid was given in the question. So if rabid word is used in the question, then we have to use local treatment plus immunoglobulin plus vaccine if they have used the word rabid. Because immunoglobulin is passive antibody. It is, immunoglobulin means what? It is antibodies. And this immunoglobulin, of course, can be derived from horse serum or can be derived from human serum. So this immunoglobulin, remember, it is not contraindicated in pregnancy. It's not that you cannot take antibody in pregnancy. It will not harm the fetus or anything like that. These are just antibodies of horse or some other human. So in pregnancy, if it is a rabid dog, we have to use immunoglobulin plus vaccine plus local treatment, because we cannot take the risk, because rabies is 100% fatal. If rabid word is not used, and because it is a scratch, only a minor scratch, so then we should go for vaccination and local treatment of wound. So vaccination plus local treatment if it is a scratch from normal dog, because then the category of wound will be second category, and for second category we need only cleaning the wound for 20 minutes under running water with soap and then giving the vaccine. Okay, but if it is a scratch by a rabid dog, or suppose they use the word scratch by a bat, or they use the word scratch on mucosa surface, in all these cases we take it as category 3 and we give immunoglobulin plus vaccine. Scratch by rabid dog or bat or on mucosa, and like suppose a dog scratch on lips, and then we should go take it as category 3 and we should give it immunoglobulin. Okay, so on mucosa, in all these cases, mucosa, bat or rabid dog scratch, we have to give immunoglobulin. If it is normal dog, we can treat it by vaccine plus local cleaning of site. So which statistical diagram is it? And they are showing what is the favorite spots of boys and girls, like that. So this type of diagram is definitely component bar diagram. We have also discussed it in the class that there are 3 type of bar diagram. First of all, why it is bar diagram? Because it is qualitative data. Whether you like football, hockey or not, whether you are a boy or a girl, these all things are qualitative, and it's just categorical. So here, one thing is that suppose I discussed this example in classes also, that if we are writing the cases of corona, cases of COVID-19, okay, and we are writing it, let's say for Maharashtra, Delhi, and UP, like that, and I am writing it in this way, that first I am writing the cases, and on the top of it I am writing the death. These are the death, and suppose the below one is the cases. Sorry, it became too thick and I should have taken not so thick, but anyway, let's make a better diagram here for Delhi. Okay, so okay, bit less case and bit less death. UP, the reporting is less, so there will be less case, and the death will also be less, although it can be more, but you know, the reporting of cases done in case of corona was not adequate. So if I am representing the 2 things, we are representing the death by this and cases by this. Okay, so it is a component bar diagram because it has 2 components. Now suppose I am representing it in this manner, where I am writing COVID-19 cases and I am trying to tell how many cases occurred, and then I am also telling how many of them recovered. Cases and recovered in Maharashtra. Then similarly, I will also tell it for Delhi. Cases, a bit less, and then recovered, of course, most of it. So this type of graph in which I am using 2 or 3 graphs together, that is a multiple bar chart. So this first one is a component bar chart. The second one is a multiple bar chart. Okay. And what will be the example of a simple bar chart? A simple bar chart will have only 2 curves. Like suppose I am writing the cases in Maharashtra and Delhi. Only I am writing the cases, not death, not recovery. So that will be a simple bar diagram. This is a simple bar diagram. Okay. Component when you have 2 things like here, this is component. Okay. And multiple when you have graph like this, multiple bar chart. Okay. Next question is, what is the complication seen in mumps out of the following? Of course, we all know that mumps can cause orchitis and oophorytis. It can damage your testis. Remember, in all of my class, we discussed that one of my batchmate, Neeraj, developed mump when he was in 2nd year of MBBS, and he was terrified, scared like hell, because now he was worried about his future, what will happen in his future. Because mumps can cause orchitis and can damage the future possibilities. So that is definitely a complication of mumps. Otitis media is the most common complication of measles. And remember that SSPE, subacute sclerosing panencephalitis, is the least common complication of measles. Okay. Now this is of course given in everybody's notes also. Whenever we discuss mumps, we always discuss that it causes orchitis that can cause sterility also. So we always discuss this epididymo-orchitis. Now a 5-year-old child present on clinic with swelling in her neck area. Because they have used the word swelling in neck, so it cannot be mump. Because in mump, the swelling is below the ear and it does not go to the neck area. Neck area swelling always represent only one thing, that is diphtheria. Because in diphtheria, we have 2 things. One is the bull's neck. This is again a photo from the note. We have discussed it, that there will be swelling in the neck, bull's neck, in diphtheria. In both the cases, you can see that. And of course, there will be a pseudomembrane present on the palatine tonsils. And this pseudomembrane, it is whitish and it bleeds on attempt of removal. So these are the characteristics of diphtheria, which was also asked in the question. Next question is again from total fertility rate. They say there are 4 cities A, B, C, D with different total fertility rate, and they are asking which of them has achieved the desired goal of TFR. So they are just asking what is the desired goal of TFR? How many children should be there per female? So this is very common knowledge. We all know that government always want to have 2 child per couple. Hum do, hamare do. Everywhere it is written and published. So we should have the number of children per female close to 2. It should be close to 2. And therefore 2.1 is the correct answer. Moreover, in my notes also we have written it that in our National Health Policy 2017, the target is 2.1. So 2.1 is the target of total fertility rate. Currently, we have a total fertility rate around 2.2. So very soon, and this is not authentic data, of course, it is the data from Government of India, but I still doubt that data. So we have not reached 2.1, but we all should know that 2.1 is our goal. If we have around 2 children per female, then our population will be stable, because then the mother and father will replace themselves by the children. So similarly, in one of the exams, they asked the question, if we have 2 child per couple, what should be the net reproduction rate? The net reproduction rate should be equal to 1. This was in previous exams, they have asked it. So if we want 2 child per couple, one of them should be girl, like one of them can be girl, one of them can be boy. So the NRR will become 1 and TFR 2.1. Okay, remember. Now, which worker is responsible for active malaria surveillance? I think it is the same question as we discussed above. it is multi-purpose worker or male health worker. And of course, we have discussed it in our class also that ASA do not have these three roles. ASA and Anganwadi worker, they both. Theoretically, ASA and Anganwadi worker, they both do not do three work. They do not give vaccine in theory. In reality, if you will go to the village, you will see that they are the one who are giving vaccine. But in theory, why they give vaccine? Because it is the work of their senior ANM and health worker, and they ask ASA and Anganwadi to do that. But theoretically, vaccination, delivery and malaria slides are not work of ASA, and you can see it is written there that male health worker MPW, which is also known as multi-purpose worker MPW, it prepare malaria slide. So of course, the correct answer is MPW, which prepare malaria slide. Now, what is the most cost-effective screening? Cost-effective screening. Some students are saying that they have used the word sensitive, and some have say that they have asked the word cost-effective. So we will discuss both of it. What is most sensitive and what is most cost-effective? Okay, screening for cervical cancer. So the answer for this is definitely visual inspection of acetic acid. And it is not pap smear or cervical cytology if they are asking about cost effective. Because let's go by PARC. Let's read PARC, what the PARC is saying on that. First thing is, they are saying that we should do pap smear every 3 years. Okay? After beginning of sexual activity, ideally in developed country, they should do screening for cervical cancer every 3 years. In India also we should, but if the facility is available, by pap smear every 3 years. But however, screening for cervical cancer using pap smear require excessive resources. So we should not use pap smear. Like pap smear is not very cost effective. They have written it clearly. Next line they are saying that we can use two things: visual inspection by 5% acetic acid and visual inspection by Lugol's iodine. Okay, so I have seen one teacher also telling you that Lugol's iodine is the correct answer, but why acetic acid is more correct than Lugol's iodine? Because they have written it again in the PARC themselves that the present strategy is to screen women using visual inspection after application of freshly prepared 5% acetic acid. So we use acetic acid solution 5% presently in India to detect cervical cancer, and acetic acid, visual inspection by acetic acid is the most cost effective method of screening. Okay, now let's discuss what is the most sensitive. Okay, so the most sensitive is definitely pap smear because it can detect all the cases and there is less chance of missing out, because we are using a cytology based things. So remember, pap smear is most sensitive and inspection by acetic acid, this is most cost effective. We know what is cost effective: putting less money, getting maximum output. That is cost effective. Now next question is very simple, simplest question I think. Under Ayushman Bharat, what is the insurance package provided? So we have discussed it in our classes also that this 5 leaf which we have, they represent 5 lakh, 5 lakh. And this money is not coming to the people account, of course. They will go to private insurance company. And if the person having this card of Ayushman Bharat, they are admitted in the hospital, then after admission, they can use the insurance card to get the money. This money doesn't go to anyone. And the premium of this much of money goes to private insurance company. So remember, very simple, it is 5 lakh rupees which is given in Pradhan Mantri Jan Arogya Yojana. And remember that in Ayushman Bharat, we also have one more part, that is Health and Wellness Center. What is Health and Wellness Center? They are saying that this 1.5 lakh PHC and some sub-center will be converted into Health and Wellness Center, where the facility of yoga, mental health and non-communicable disease treatment will be given to the people. Okay, so it's just a renaming program, not much fund has been given to it, but still remember Health and Wellness Center in place of PHC Sub Center. Okay, and in Ayushman Bharat we give 5 lakh rupees to economically weaker section who are earning less than 10,000 rupees per month. Those family get this Ayushman Bharat benefit of 5 lakh insurance. Now, most common cancer in head and neck region in India. Of course, simple question, if these options were there, then it is more simple. Oral cavity. Now, if they have removed the word head and neck and they have asked the question most common cancer in India, then the answer can be dependent on male or female. For female, the answer is breast cancer, and for male, again the answer is oral cavity. This is the data from recent PARC edition that I am sharing with you, that oral cavity cancer is more common than lung cancer in India. Remember, in male, and in female, of course, breast cancer is most commonest. So, anyhow, even if they have not asked the question head and neck and they ask most common cancer in male in India, the answer will be oral cavity. And suppose they have not used the word male also, they only ask the question most common cancer in India, then the answer will be breast cancer. Let me tell you the data directly. Okay, so this was also being written in the notes. It is, you can see it, we have discussed it under non-communicable disease program, that the male have this oral lip cancer which is most common, and in the female we have breast cancer which is most common. Okay, now let's go by the data given in the PARC textbook. This is the summary statistics 2020 in India, of course the latest PARC edition, which says that in male, and first let's talk about male, lip and oral cavity is most common, second common is lung, then we have stomach and other, and in female breast is more common. But now let's look all over India. If they ask both sexes, not male or female, they ask most common cancer in India, answer will be breast cancer. And if they ask most common cancer in the world, again the answer is breast cancer. Let's see the world data now. See, most common cancer in the world is also breast cancer. Okay, and in the world, because in the world they do not chew so much tobacco or so much gutka like Indian population, so in the world oral cancer is less common as compared to India. And in the world, lung cancer is more common in male, breast cancer is more common in female, and breast cancer is more common in both India and world overall. Okay, remember in India, due to khaini, tambaku, jarda, surti, we have more oral cancer and oral and lip cancer. And I have seen some of the doctors also chewing this gutka, and I was surprised. How can, it is very difficult to keep spitting after every some time. We should try to get rid of that habit, of course. Now, school health is a responsibility of sub-center, PHC, CHC, medical college. Difficult question, but if you have read it in the notes, we have always discussed under I program also and under school health program also, that this vision center which is present at PHC, this vision center at PHC looks for a school health program, because we know that in eye health programs there is vision center, service center, training center, center of excellence. VSTC is the mnemonic. So this vision center which is at PHC and which should be 20,000, this is the one which looks over school health program. Okay, so remember, school health program is looked by vision center which is present at PHC. So the correct answer was definitely PHC. Okay, after vision center we have the service center, in which we have which is present at CHC and which has 2,000 expected number. Then we have training center at medical college and center of excellence also at medical college. Training center will be 200 and center of excellence will be 110 less. So this is there. Now, a question which was also asked in the previous exam, which of the following is not a component of primary health care? So the 4 pillars are there. In the last exam, they have used the word adequate technology. So that was the wrong answer, because adequate technology is not the pillar. It is appropriate technology which is the pillar. Community participation is the second pillar, of course. Intersectoral coordination is the third pillar. Universal health coverage is not a pillar. Of course, the fourth pillar for primary health center is equitable distribution. And by equitable distribution, we simply mean that if you are going and working in a rural area or in a cities area, your first focus should be in the slum area. Your first focus should be the Harjan Mohalla, which are most poor people. Try to have some food from their plates, eat some dinner with them, and give your more focus to them, which need more of your attention. That is equitable. And give more to those who need more. It is not equal. And this is our fourth pillar. Okay, so answer was universal health coverage. Of course, it is given in everybody's note that equitable distribution, community participation, intersectoral and appropriate technology. Universal health coverage is the World Health theme of WHO, and to achieve Sustainable Development Goal 3, we need to have universal health coverage, but it is not a pillar of PHC. Now, a patient presented with liver cancer and he was working in some grain industry or groundnut industry. So what is the toxin responsible for it? So here the toxin is aflatoxin because it causes liver cancer, and aflatoxin is released by Aspergillus flavus. This Aspergillus flavus is present on groundnut and it can also be found on maize. And what does this Aspergillus flavus toxicity causes? It causes liver cirrhosis, hepatocellular carcinoma. That is Aspergillus flavus releasing aflatoxin present in maize and groundnut. Now, one more type of toxin is ergotoxin, which is released by wheat and rye. Wheat and rye. If you have wheat and rye toxicity, then ergotoxin is released from there, and this ergotoxin, it causes peripheral cyanosis, okay, and it can also cause hallucination, because we all know in treatment of migraine we give ergotamine. So that ergotamine causes vasoconstriction and decreases the pain of migraine. So similarly here also this ergotoxin causes this capillaries constriction, and it can cause cyanosis, necrosis, and in some stages it can also cause hallucination. So because in the question they have used the word liver cancer, so no doubt the answer is aflatoxin. Of course, we all know that sanguarine is responsible for epidemic dropsy. Okay, and in epidemic dropsy we have bilateral pitting edema. So you can very easily remember it by imagining that you are sleeping with someone of your dream. Okay, so if you are sleeping with someone of your dream, of course there will be, sleeping is sanguarine. Sang means together, in Hindi sang means together. So imagine you sleeping with someone of your dream, so you are together, sang, and there is, of course, when you sleep there is dropping of eyelid, and there will be also pitting edema, dropping type of thing. If you sleep for a very long time because you are sleeping with the girl of your dream or the boy of your dream, you will sleep for a longer time, and when you will wake up there will be puffy face or something like that. So that will be pitting edema, you can see. So dropsy, pitting edema, sanguarine. If you remember this by this interesting mnemonic, you will not confuse, because pyrazolidine, it causes endemic ascites. So the confusion is between these two things. So we must have to remember sanguarine, dropsy, bilateral pitting edema, and this epidemic dropsy, it occurred due to eating contaminated mustard oil and contaminated with seeds of Argemone mexicana, Satyanasi seeds. Okay, and BOA is of course the neurolethyrism by eating khesari saag. Okay, so these adulterant are important. I am obstructing the abdomen of my friend here. So given condition is due to deficiency of, you can see there is a protruded abdomen, but the child do not seems well, they seems a bit puzzled and irritated side kind of thing. So what is the correct answer? Is it due to only carbohydrate, only protein, or both protein and energy? The correct answer is only protein, because it is Kwashiorkor which is only protein. If they have given the image of a marasmic child just opposite to me, a thin child, then the answer will be protein and energy both. But because they have given Kwashiorkor, it is only protein. We have also discussed it separately in the note that, remember, deficiency of protein is Kwashiorkor and both protein and carbohydrate is marasmus. And in Kwashiorkor, we will have protruded abdomen along with fatty liver, very commonly asked. Fatty liver, flag sign. What is flag sign? There will be some brown hair, some black hair, so it looks like flag. And a flag sign, fatty liver, and then there will be irritated child with protruded abdomen. And so these are things in Kwashiorkor. Nowadays, I also have protruded abdomen, but it's not due to less protein. It's due to more eating more and working less. But anyway, it will go away soon, I'm very sure. So remember, this 4 thing: fatty liver, flag sign, irritated child, not interested in eating, Kwashiorkor, which is only protein. Now, a 30-year-old person coming from China suspected of COVID-19, which of the following you do? Of course, we will do RT-PCR. Even if they have given rat or something like that, that is not investigation of choice. We will do RT-PCR. We have discussed it in our classes again and again. We all know that RT-PCR should be done for corona. First step to be done for immunization survey. So if you are doing immunization survey, what do you want to know? You want to know how many children are vaccinated. So what you will try to know first? First you will try to know how many children are vaccinated in last year. So by that you can know whether the immunization is going well in that area or not. Okay. And how we do vaccination survey? We do it by cluster sampling. Remember, in cluster sampling, we have discussed it also in the class that we take 7 children from 30 villages. Total sample size is 210, and all these 7 children should be between 12 to 23 months. We go to their houses, and when we go to their houses, we ask the mother that how many vaccines the child has received. Can you give us some card or something to know? So first question we ask always is, how many children are vaccinated? We ask this question, of course, from the mother, and we do it universally in the same way. So the correct answer is, for any immunization survey, first thing we have to know how many children are vaccinated by asking this question from their mother. Now, doctors doing work and extracurricular activity. And like, suppose you are working in a hospital as a doctor, but you are also attracting patients. You are also doing the work of marketing, or you are also doing the work of counseling. And these all are extracurricular activity which you can do. And or you are also maintaining the drug storage facility. So these are extracurricular activity which you are doing. Now, if a study is planned to know the future requirement of doctor, future is hidden, but anyway, this is future requirement of doctors. You want to know that, you want to know which doctor should be selected for your hospital. How will you know that? So let's go one by one. What is cost benefit analysis? Cost benefit analysis means you will try to find out, okay, this much money I give in the input, and in the output, how much money I will earn. This is cost benefit. Cost effectiveness means you will try to find out, okay, this much money I will put for that doctor salary, and what is the output I will get. Output means not output in terms of money, but output in terms of quality of work, output in terms of number of life saved, or number of life improved and all, and a life saved. So basically, when we are talking about extracurricular activity, we cannot measure it in money. So cost benefit cannot be the correct answer. But we can measure it in effectiveness. Effectiveness means number of life saved or number of life improved. What is the overall advantage? So cost effectiveness can be correct, but it is not talking about only one doctor who is doing such extracurricular activity. out of 10-20 doctors, some doctors are doing extracurricular activity. So it means what you have to do is you have to compare cost effectiveness of two or more program or person. There are many doctors which are present, and out of those doctors you have to compare which one is more cost effective. So we can do it by system analysis. System analysis tells us how to compare the cost effectiveness of every doctor, and then the doctor who is most cost effective will be selected. That is, cost effectiveness analysis of two or more person is done by system analysis. So the correct answer is system analysis. Why not network analysis? Because network analysis is very simple. We plan our time before taking action, and we have PERT and CPM under it. In PERT, we plan our time before taking action. Like before going to exam, you plan, na, okay, this many subject I have to revise, this many, like that. So all this is PERT. And CPM means critical pathway method. We must give more time to the work which is longer and more time taking. For example, you should give more importance to medicine and surgery, which is more time taking and all for your exams. So that is CPM. I have also, of course, discussed it in the class that cost effectiveness analysis means input in money and output in life saved, and system analysis means comparing cost effectiveness of two or more program or intervention with each other. So we are comparing many doctors based on their work and extracurricular activity. So the answer is system analysis. Next question is about a man who traveled to Assam and then returned back. So he is confirmed to be having Plasmodium falciparum. What treatment you will give? So if he is in Assam, it means he belongs to northeastern state. And in northeastern state, artesunate is resistance. So we give artemether plus lumefantrine plus primaquine. But primaquine is given only on day 2. On day 2. Okay. Otherwise, we will give artemether for all the 3 days in northeastern state. And if it is a state like UP, Bihar and all normal states in the plain, then we will give artesunate. Okay. So the correct answer is B, artemether, which can be given intravascularly. It can also be given in the IV form. Now, this is of course being also discussed in everybody's class that in northeastern states like Assam, we give artemether, lumefantrine, primaquine, and in other states we give artesunate. So the correct answer is definitely artemether. Now, previous exam they have asked that if someone is coming back from an area endemic for malaria, for how long they should continue taking malaria chemoprophylaxis. So remember, suppose someone came from UK, England to our India again. So this time if they come, because UK and European country are free from malaria, so they will start taking chloroquine or doxycycline or atorvastatin, other chemoprophylaxis drug, and they will continue the chemoprophylaxis drug for 4 weeks after going back from endemic country. Even after going back from India or endemic country, they should continue taking this tablet of chloroquine or doxycycline or atorvastatin till next 4 weeks. Okay, remember that. Now, next question was based on case control study. A study was done to know the risk factor of obesity. Why we are developing this pregnancy? Why we are becoming fat? So this is a case control study. So what should be the two groups? Very simple. Because it is a case control study, so in the group, one should be the case, one should be the control. What do you mean by case? Case means those who have disease. Control means those who don't have disease. So in case control study, we always start with disease and no disease. Now, when I say exercise, no exercise, exercise is not a disease. Even if you are not doing it, it is not a disease. So exercise is an exposure. Similarly, eating online food, not eating online food, that is also exposure. Smoking, non-smoking, that is also exposure or risky behavior. So all of these three, they start with exposure. and cohort study is the one which starts with exposure. So all of these three are wrong because they are starting with some risk factor or exposure, and a cohort study start with exposure, but a case control study start with disease. So we will start with one group who are obese, one group who are not obese. The answer is C. Okay, of course it's being taught in class that in case control study, first thing that we look is case and control. We put, suppose I am comparing what is the cause that some of us are cool, some of us are not cool. So we will put cool student over here as control, and we will put anxiety, anxious student over here as case, anxious and cool. And then we will try to find out what are the risk factor, why some of them are cool, why some of them are anxious. Okay, so the correct answer is of course one group with obesity, one group without, because it was written it is a case control study. Now, reproductive health promoting agency in the world, definitely it is United Nations Fund for Population Activity. Fund for Population Activity. Remember, in all of our class we make joke of this topic, that do they give money for having more population activity? No, of course, they do not give money for more reproduction, they give money for preventing the reproduction. So the health promoting agency which is preventing the reproduction or promoting the reproductive health is UNFPA. And of course we can discuss in the class as well about the UNFPA, which is giving fund for reproductive health. Now this is a question which is something which I have not discussed in my class. It is outside from my notes. Which agency fund for TB program in India? So the answer is SIDA. SIDA fund for TB program in India. Similarly, they can also ask which agency is funding for sustainable development goal. For sustainable development goal, the fund comes from UNDP and World Bank also fund it. But main funding organization for sustainable development goal is UNDP. Okay, let's talk about SIDA also a bit. SIDA means Swedish International Development Agency. You can see the page from Park latest edition. And SIDA assists in the procurement of supply of, it is the one which is giving fund for our National Tuberculosis Control Program, SIDA. Now what is DANIDA? It is Denmark. SIDA is Swedish, DANIDA is Denmark. So DANIDA is funding the blindness program. It is funding the blindness program. And SIDA is funding the tuberculosis program. Remember, SIDA for tuberculosis, DANIDA for your eye program. Okay, so that's there. Now, lowest center where patient can go. What is the lowest center where patient can go? If subcenter and PHC both are in the option, the correct answer will be subcenter. If subcenter is not given in the option, then the next one of course will be PHC. And we all know that the next is CHC. Then CHC and district hospital, they both are secondary level. And then in the tertiary level, patient go to medical college. That is the 3-degree level. And district hospital is also 2-degree, just like CHC, it is 2-degree level. So remember, PHC and subcenter both are primary level. And CHC and district hospital, they are secondary level. So first of all, patient go to subcenter, or he can also go to PHC directly. No one will stop him. But the first lowest center, if they ask, that is subcenter. Then if subcenter is not in the option, then PHC is correct. And remember that PHC is not a referral center. It is not a referral center. Why it is not a referral center? Because PHC and subcenter both are at the same level. So theoretically, not practically, but in theory, PHC is not a referral center. Okay. So CHC can act as a referral center. It is a referral center. If there is no first referral unit FRU, then CHC will be the first referral center. If first referral unit is not present, FRU is not present, CHC can be first referral unit. So what is the lowest center? That is subcenter. It is, of course, in the notes it has been written that subcenter is the first point of contact First point of contact, lowest center is subcenter, and after that we have PHC, then CHC. Disease caused by following mosquito. Can you identify the mosquito? To identify this mosquito, we have to see what are the options are there of the disease and all, and it's not so difficult to identify. There is a characteristic hump at the back, and it is sitting at the same line parallel to the surface. So this characteristic hump and parallel to surface, this both thing points that it is Culex. And we all know that Culex is known as nuisance mosquito. And this Culex, it causes 3 diseases, of course, JE, filariasis, and West Nile fever. West Nile fever. So the correct answer is JE. Okay. Now, why Aedes and Anopheles are not the answer? Because we all know Anopheles sits at this angle, 45-degree angle. It doesn't like to touch our dirty skin. No touching. So that's why it is known as sophisticated also, because it breathes in clean water and makes an angle. So it never sits parallel. So it's not Anopheles. So malaria is out of question. And in case of Aedes, we all know there will be black and white stripes over the body, which is not present in this mosquito. So it cannot be Aedes. So dengue, Zika virus, yellow fever, Rift Valley fever, and chikungunya, these all which are caused by Aedes, these 5, they are out of question. Okay. So let's look at the notes. Of course, you can see in the notes also we have discussed that Anopheles breeds in clean water, and it sits at 45-degree. Remember, Anopheles have a spotted wing. Okay, Anopheles, spotted wing. Now this is Culex, which is also given in the exam. Okay, and then this third black type of mosquito can be Mansoni, but Mansoni causes one disease, Brugian filariasis. Only one disease, Brugian filariasis. Because Brugian filariasis was not in the option, so we need not to confuse. But again, you can differentiate between Culex and Mansoni also, that Culex is brown in color and Mansoni is black in color. Okay. They both have hump and they both sit at parallel to the surface. But they have never asked Mansoni. But still we should be ready for it. If they give the black color mosquito like that, that can be Mansoni. So thank you very much for listening this discussion. Hope you enjoyed the discussion, and I really hope that these questions can be useful for you in your future exams. Thank you very much for listening. Hasta la vista. Das vidania. Bye bye.